Good morning, everyone, and welcome to today's session at the Healthcare World Series. My name is Steve Gardner. I am the Managing Director at Healthcare World, and I'm delighted to welcome you today to a session, our second session on healthcare in Saudi, part of our series on the Kingdom this year. Today we'll be talking about digital transformation and data in the Kingdom of Saudi Arabia. And I think, I've said before that I think that Saudi Arabia probably represents the most exciting opportunity in healthcare around the world at the moment. Huge opportunities to create, really from almost from scratch, a free at the point of delivery government-led healthcare system, which ultimately will then be paid for by a national insurance scheme, and opportunities really for organisations from across the globe to get involved in that reorganisation. And nowhere is there more opportunity than in the digital health and data sector. And that's why this morning we brought together 4 fantastic experts who've worked extensively in the Kingdom over the last few years to answer some questions, not from me or even from you, although please do use the red button that you can see on your screen to ask any questions that you'd wish to. But we've even brought in a group of people to ask the questions for us. We have with us some really interesting suppliers, technologists, companies involved in the cusp of digital health innovation, who will be asking questions of our panel. We'll introduce those as we go along. But first, let me introduce the panel themselves. And we have, in no particular order, Christina Sajaki from Al-Tamimi & Company, one of the region's leading law firms. We have Mansour Ahmed, who is the Executive Director for Healthcare at Consultants Colliers International, has worked extensively in Saudi Arabia. And 2 very, very special guests in SML Newman, who is the Vice President of Digital at the Eastern Health Cluster, with whom we're working very closely. And the brilliant Ahmed Balkhair, who is the Chief Digital Officer at Oberkern Investment Group, and also a former Deputy Minister of Health for Digital Transformation and Data. So a fabulous panel, some really interesting experts. So without further ado, let's get into the debate. And I'm going to start, I think, with a question from Praful Mehta from Vamstar. Praful, do you want to give yourself a quick introduction and then pose your question to the panel, please?
Sure. Thanks. Really great to see everybody and appreciate the opportunity. So my name is Praful Mehta. I am the CEO of Vamstar, and Vamstar is bringing artificial intelligence into the supply chain sector. So we work across the board in creating and simplifying procurement and sourcing, whether it's for digital health products and services or for pharmaceutical drugs and medical devices. We are making a big inroad into the UAE as a board. We have decided to make big investment in that region now and entering Saudi Arabia with partners like NAPCO and in the region also partners like Rafid in UAE. The question I have for the panel is, as you know, Kingdom has embarked on a very amazing journey to really change things from ground up. What are the critical challenges do you foresee in that transformation?
So what are the critical challenges in the transformation of digital healthcare in the Kingdom? Let's start with Ahmed. Ahmed Balkhair, do you want to give us your thoughts?
Thank you very much, Silly, for having me with you in this panel discussion. It's an honor and a pleasure to be with you in this session. And first, I would like to see really what things we are pleased in our journey here in the Kingdom, other than the other countries. We are pleased actually during this period to have a unified really vision, which is Vision 2030, and we have also an integrated strategy with all ministries are working really together toward strategic objectives and goals. And also we have with that strategy a budget, and unlike maybe other programs worldwide, sometimes they have a shortage in this area. Also with a very mature business strategy. So when you build this digital strategy, you need really the business strategy to be very clear with the changes that are going to happen in the Ministry of Health, in corporatization, in governance, how they would like to fund the healthcare service, how they would like to go into the new model of care and healthcare service, how they would like all the sectors to work together, of course, and even the private sector participation in that. Also the great support we have, the minister and the vice minister, both of them are coming from IT and business also side. And in addition to the sustainability, actually, I worked in the last 12 years in the ministry in 2 occasions. One of them was toward building the core things like standard and these things, and afterward, it was toward executing this program, which is starting in 2017 almost. And the challenge is really that we face, and which all other countries face, is initially the standardization, which is because the data is the most, for example, important factor to improve healthcare service. And of course, how we can have integration, interoperability, having unified health records is one of the challenges that have a prerequisite of building the standards, whether coding standards, interoperability standards, even technical specification, and many things. Also, we need to be operable before being interoperable. So we need to have all our facilities have systems of records so that they can interact with each other. And with the new business model and the new corporatization, where we do have clusters, each clusters have a full accountable and separate full management and control. They need whatever system they have to be able to integrate with other 20 clusters, in addition to the other governmental sectors, which represent 20% of healthcare in the kingdom, and the other private sector, which is also 20% of the healthcare sector in the kingdom. Also, we need to have initially to start very quickly to have a centralized solutions and gradually to move with giving full independency to other systems to be incorporated. Also, we have a challenge with the local resources actually, and for example, the SMEs, we have a great difficulty on, for example, building some of the complex RFPs, like building the RFP for the unified health record, building the RFP for building developing standards, building the RFPs of managing the, for example, the strategy management office itself in the beginning. So we seek RFP worldwide, SMEs worldwide, which have really, there are a lot of shortage in those experts, for example, interoperability standards and these things. Also, we need the transformation leaders in each of these clusters and in each of the facilities and each region, which is also one of the areas where we have difficulties and shortages, mainly in the areas of the rural areas other than the main cities. Also, there are some difficulties in the maturation of some of the regulations. For example, the SaaS contracts here in the kingdom. It was something newly, and everything is now moving to be an OPEX mode rather than CAPEX and in a SaaS models. So it requires in governmental sector to contract to have a lot of regulation that support that from financial point of view as well as from a regulatory point of view to have it easily. And nowadays it's easy to subscribe, unsubscribe, upgrade. You pay per use and pay per consumption and so on. Also, the availability of local providers who give these SaaS models. So it took some time until all the local providers, whether the telecom companies or so on, to get into this game and provide these solutions in a SaaS model. So we pass almost into all the challenges that other countries have when they move into their digital health transformation journey in the healthcare precisely. And we tried also in the kingdom to be business driven rather than technical based. I hope that gives some of the challenges we have.
No, that's a really fantastic overview to start us off of so many of the things that are going on and so many of the issues and successes. One thing you talked a lot about there actually was the development of the clusters and how the clusters are going to play a key role in that. And of course, we're lucky enough to have the VP of Digital Health from one of the clusters with us. Essam, do you want to give an insight and an answer to Praful's question in terms of what are the key challenges that you're facing from the cluster's point of view in terms of the digital revolution, I guess, in your area?
Yes, first of all, nice to have you, just to be with you today. And I cannot say more than what Dr. Ahmed mashallah said, but alhamdulillah, gradually when we started, the journey for digital transformation, we faced a lot of these kind of problems. Starting with the infrastructure, alhamdulillah, we started with a good infrastructure with the Ministry of Health support. We managed to connect all the healthcare centers with hospitals together in one network. And we continue from there to have more and more just specialties, or let's say solutions to overcome these problems that we are facing. As also Dr. Ahmed said, we are having a problem with the manpower, with the capabilities. So one of the main challenges, it's just to build the capabilities for this cluster and other clusters. So capabilities from the manpower, that to start with the manpower, the right people to do what. Also the, let's say, current vendors, some of them, they are not ready to give the current support, or they are not aware of where we are going. So we need just to have more and more people just aware with us. One of the challenges actually, it's to have a unified electronic medical record or a unified HIS. As the cluster here, alhamdulillah, we managed to have, let's say, 124 healthcare centers with an HIS, hospital information system. We have 8 hospitals now, or let's say 12 hospitals or 11 hospitals out of 22 now they are having an HIS. We still lack of some of the hospitals, they don't have an HIS. So this is one of the challenges that we are facing now. Because if we want to move to the next level for the data management and the other things, we need to have an HIS to start with. So this is one of the main challenges that we said here. And alhamdulillah, we have a great vision that we are all following. We have also standards now with the health company, with the MOH, with also the cluster. We have a digital blueprint. We are running through this. We managed to work with the health company to start working with it with great initiatives. In our cluster, we have around 50 initiatives related to all the, let's say, areas of for building the capabilities, giving the training, setting the standards, having a partnership with the companies to just overcome these problems and continue forward. The good thing that some of these challenges we are having starting from scratch. So we don't need just to go for the whole cycle. We will just start with everyone what they end up, so we can continue to the future together.
I think what's really interesting to me, and I did an interview the other day with Dr. Ahmed Masayed from the cluster, and it's amazing actually how much you've already achieved. Yes. But there's so much to do and so much opportunity. Christina, a couple of mentions, particularly in Ahmed's opening there, of the way in which we contract some of this and some of the legal challenges. What do you see in terms of the issues for the companies that want to come into the market and help here, and the way in which they're contracted?
So there's actually recently been issued a new a private sector participation law, which aimed to address a lot of those prior contractual issues that foreign companies were facing in contracting with the government. And so under that law, such things as, and not to get too legal with everybody, but one of the key highlights was now the government has the authority to, under certain framework, to enter into arbitration as a means of settling contracts. And that was a huge advancement. And this can offer more known, comfortable ways of settling disputes, because of course for a company entering a new jurisdiction, they might not understand or be familiar with the local courts and the way settlements and the way disputes are addressed. So opening up the options, for example, for arbitration to be in the contract has certainly been quite a positive. The other thing we've seen when you look at just some of the foundational rules in the kingdom regarding foreign ownership. And this is often, it comes into play where a company wants to do business in Saudi, it might be required to set up locally. And there's been some reservations about whether and to what extent they can 100% own that company and what are the requirements. And you'll see the Ministry of Investment, formerly SAGIA, for those who have been in the region before, but now called MISA, has a very dedicated pathway for foreign investors, which under new laws, even under the Ministry of Health and SFDA, which is allowing medical clinics and certain pharmaceutical institutions to be 100% owned. And so this has really opened up the opportunity for foreign investment in the kingdom. There is still quite a substantive framework in place. It certainly hasn't opened up to be a free-for-all, but the pathways have definitely made it more attractive and more easy to do business with and contract with the government in the kingdom.
Christina, Dr. Ahmed talked about SaaS models and how they were kind of being used by digital suppliers in the company. Of course, they've become commonplace around the world. Are there any differences or any issues in terms of the way that SaaS models can be adopted in the kingdom?
I will have to pass on that question. I have an expert digital and data team. They were the ones who dive very deep into those contracts. So definitely any questions from specific audience members to take offline, I'm happy to address those. But I have an expert digital and data team who will be able to dive more deep into that. Apologies.
We'll publish the answer on the Healthcare World
Perfect.
website. 15 minutes in and I'm asking difficult questions already. Let's move on to Mansour. Mansour, you've worked in Saudi for many, many years. And I'm sure you're seeing a lot of change at the moment. What do you see as the challenges in terms of adopting a truly digital model of healthcare in the kingdom?
I think the challenge is, first of all, there are opportunities because the market is very big. You have, if you look at, there was roughly 150 million inpatient every year at this moment. Sorry, outpatient, which are seen by all the doctors in Saudi, which are expected to go up over 220 million by 2030. So, there's a lot of opportunities, but what we can see is the challenges is that there is, Saudi is, you have some 2 or 3 or 4 big cities where there's a lot of concentration, where technology and income level is high and other, because one of the major thing is to having this kind of technology is having a smartphone and other. Now, a smartphone and other may not be affordable by different economic tier of the country. So I think the challenges is awareness. Challenges is reaching to which supposed to be that all this digital health and other should help to reach to the even smallest of the towns and other. But the challenge is that it's a Saudi so widespread to go and reach each and every small town and city. Challenges is that maybe if the 2 gentlemen who are there from Saudi can correct me, but there is no standardization of different the program and other which we are doing. There are number of clusters and government entities, and as far as we understand it, that they are looking not the one model, they are looking at different models. So I think these are the key challenges, but there is so much opportunities, and especially COVID has exposed that because digital health will also link to the telemedicine and other, that opportunities are far more greater than the challenges, and based on our experience, it will be a short while where these challenges will be overcome, and digital health will improve the overall quality of the healthcare in Saudi.
Thanks, Mansour. So let's move on now to our second question, which comes from Ian Chambers from Linear. Ian, do you want to give a very quick introduction to yourself and then ask your question, please?
Good afternoon, everyone. Thanks, Steve. Ian Chambers, CEO of Linear. We help healthcare organisations and government organisations resolve complex challenges and problems from a strategic, operational, transformational and digital perspective. We've also got a number of innovative technologies and applications as well. My question is a 3-part question. First of all, is to understand how the digital technology is being used to realise the 2030 vision. And then as part of that, particularly the transformational and the workforce challenge aspects of that vision. And then the third part of that question is, given the number of things that are going on within the kingdom, how is that being coordinated both nationally and regionally to make sure there's standardization?
Thanks, Ian. Let's go to Estem first on this one. Estem, I guess the third part of that is the one that interests me particularly. How does this work in between regional and national How do you ensure digital solutions are coordinated at both the regional and the national level?
Yeah, actually, we have, as Dr. Ahmed mentioned before, and also Dr. Ahmed Musad yesterday, or when you met him at that time, that the government now, they are having standards. Now we are having a platform for the, let's say for the electronic medical record. It is having two parts, one part for the claiming and for this one, and the other part for the clinical. And already the government, they started this thing, and we are already on board of that thing. So all our activities, it is following their standards, and let's say from the health exchange and other standards that they are following, and all the programs that we are running here in the cluster, it's following again the MOH standards. Let's say for the telemedicine, for virtual clinics, for the KPIs that the government, they are just asking us to provide them with the data for that thing. So for sure, what we are doing here in the cluster, it is reflecting all the national wide, and also we are also as one of the main clusters here in the kingdom. We are also we can say that we are running this scenarios as a pilot in our cluster, and then reflecting it to other clusters or other national programs. So from this side, we can say we are okay in that part. And I think and Dr. Ahmed, I think he can also elaborate more, because he is one of the key leaders of the projects that we are talking about now.
Thank you,
Ahmed, I think the ball has been passed to you there.
Yeah. Thank you, Yasser. Thank you, Steve. There are in the national e-health strategy, we divided, the categories of the solutions and projects into three categories. One of them we consider it like at the national level. These national level solutions should be one level across the kingdom, so no repeated across different sectors. And then an example for that is the Unified Health Record. Building standards per se is only built in the National Health Information Center. The Unified Health Record, as mentioned by my colleague Yasser, it's an Nafis engine. It contains both the financial and the clinical interoperability engine, where all systems will be connected. So it will be only one solution across the kingdom. Something called National Health Observatory, which is the analytics across the kingdom. Some of the central solutions like e-sick leave, like referral systems, and so on. These are only one system. So whether the 60% of Ministry of Health clusters, or the 20 that provide, 60% of the service in the kingdom, or the other governmental sector who provide 20% of the service, or the private sector who provide 20%. All of them, they will utilize these solutions as a national. The second group of solutions are the enterprise solutions. These are some solutions that are built specifically for the 20 clusters that are emerging from Ministry of Health. So they're going to be managed by the holding company, and it's going to be like a shared services for them. So whatever services are not going to be bound from the corporatization point of view, like the lab, we're going to be that are not going to be bounded to the cluster, going to be connected to those shared services. For example, the EMR solutions, the lab solutions, and some like blood bank solutions, toxicology centers, forensic medicine services. All of these are considered enterprise solutions, but it is specifically for these MOH clusters, but other governmental or private sector, they can have their own. The third group, which is the cluster based, these are the specific solutions that are pointed to these to the clusters, and there is an orchestration between all of them utilizing the same standards. All of them are mandated to build up the integration adapters to connect to these national solutions, so that we can collaborate together in the referrals, collaborate in exchanging data, and also exchanging the orders of the medication for the patients. So this is how it looks like now. From the Vision 2030, building these into a very clear, integrated manner, having a clarities of these levels, utilizing the national services. We have the national services, some of the things that's really speeding up what we are doing, like IAM, which is the single initial authentication manner to identify the identities. So even those people coming to the kingdom, by the way, for the first time during COVID, they can have Tawakkalna, where they can use the IAM service to access their health, well-being, and the vaccination and distance. For us as a citizen, that Tawakkalna, I can access all my family members. I can see everybody working also with me as my driver. I can see everything. And there are some limitation in privacy and confidentiality related to health and some matters. So more than 13 years or 15 years, they will be able to manage their own things. So integrating all these things will provide and is generating actually daily an innovative idea of a new business models that can be emerging. In addition to that, it's really helping us really to leapfrog and to run very fast, and even it overcome many of the challenges that we expect using our unified health record or our super app in the healthcare, where I can manage my family members' health, at least the young children, and the older they will be. I can run, I can do some of the things, but I cannot, for example, access their medical files because they have their own privacy unless they give me the permission. And sort of all these things now can be achievable with the integration of this full national vision of Vision 2030.
Again, fantastic answer, Ahmed. That was absolutely brilliant. Really, really insightful. Let me just make sure that I understand this properly. So, if I'm hearing this correctly, what you have is you have different levels. So while the clusters are allowed to use and implement their own individual solutions at a regional level, those solutions have to follow the data standards, the overall standards that have been created nationally, and there are some national countrywide solutions that are being implemented. Have I got that correct?
Exactly.
Really, really helpful, Dr. Ahmed. Thank you so
If you allow me, from our side, actually, as a cluster, we are building what we are doing now. We are making our cluster ready to connect with all these platforms and to be ready for other things. Let's say our healthcare centers all connected together and connected to these platforms. Currently, we are having 8 hospitals or 12 hospitals connected to each other. We are having unified now electronic medical record internally in the cluster. And this electronic medical record will be also connected to the national-wide electronic EMR file.
That's really helpful, Essam. Thanks very much. Mansour, I want to bring you in on this one quickly. From your perspective, and you look at the health system as a whole, how important is digital to the 2030 healthcare goals?
Yeah, I think I'll basically pick up 2 sort of case studies. One of the key aspect of 2030 plan is to promoting more home care, which will help a lot of people to move from the long-term and rehab to the home care. And also, as the old population, there is an increase in 60+ population in Saudi, which require home care. Now, at this moment, home care is very, we were doing some work, and on average, probably, if you look across Saudi, an old patient get 4 or 6 visits a year, and on average, where they maybe look a continuous monitoring every week or so. So I think one of the things, and there are roughly 100,000 by end of 2022, there should be at least roughly 100,000 home care patients in Saudi, which are expected to grow 2 or 3-fold within next few years. So I think digitalization and then linking the telemedicine and other thing will have lot of improve the livelihood of old people who require home care. And because at that point in time, it will be not possible to send doctors twice a week or something to check out on them and other. And it will also add a lot of cost. So I think this is solving 2 issues. One is that quality of healthcare will increase because more access will be available for the patient to the health provider. And second, this will have a very good impact on the cost reduction. You don't have to hire 100 and 1,000 of doctors who will be doing regular home care just to check on the patient, and a lot of things can be done on digital health. And the second thing which I'm going to, you have to excuse me, I had a very bad throat infection actually. The second thing is, unfortunately, and in Saudi and some of the GCC country, 30 to 40% of the population has one or more than one lifestyle diseases, which is diabetes, hypertension, and other. And what is regularly happening? The patient goes every 3 months and go and check on the, meet the doctor and sort of just get a refill and other stuff. Especially in case of digitalization, and having the the wearables and other will help to monitor this lifestyle diseases, because this is very important. One of the key thing which we think in at Collier is that if these lifestyle diseases are not controlled, this will have a major impact on demand for infrastructure, unnecessarily demand for healthcare infrastructure in next 5 or 10 years, because these lifestyle diseases results in cardio, different kind of life-threatening diseases after a few years or so. So just picking up two things, I think what is happening in Saudi is going to improve the quality of health, reduce the cost to provide that high standard quality. Accessibility will increase, and especially in case of lifestyle diseases, using digital technology and wearables, if that is being controlled, that will going to save billions of dollars for Saudi in next 5 or 10 years. Because if these lifestyle diseases are not controlled, you will need a lot of inpatient beds.
Thanks, Mansoor. Let's move on. We've got a lot to get through. We've got another an hour to go and lots and lots of questions. Let's now delve into the data side of things for our next couple of questions, starting with a question from Royston Adamson Green at Lineate. Royston.
Hi, Steve. Thank you very much. Just a quick intro. I'm Royston Adamson Green. I'm the Director for Channel Sales across EMEA and APAC for Lineate. Lineate are a company that specializes in interoperability solutions, and we deal with integration. We deal with enterprise master patient indexes and provider registries and things like that. So we're class leaders in all of those things. So we've been that for many, many years. So we've got some installations within the region. The Malafi project within the UAE, which is underpinned by our EMPI and Rhapsody integration engine. We've got we had some customers in actually in the Kingdom at the Royal National Guard Hospital. So we've got a reasonable kind of impact into the market across the region. We're a company that, as I say, we're specifically healthcare. So we don't really do anything else. We're very, very focused on that. And Lineate has this integration, unified platform for interoperability, following IHE standards and very much standards based. So what we've got is a drive towards 100% accuracy in patient identification. That's what we specialize in. So my question, in a increasingly consumer-driven world where people have mentioned that about smartphones and people's access to data via those, the patient expectations that we're starting to find is that they want to have access to their medical record data on their smartphone or their smart device. Would a fully secured and credentialed digital identity solution on a smartphone be valuable to the cluster or across the region to ensure that the correct person is accessing their data? Or has that already been addressed across Saudi Arabia?
Ahmed, I mean, the first question there is what level does this sit at? Is this at national level? Does this sit at cluster level? How would something like this work?
Yeah, thank you. I believe we are really thankful to the national infrastructure actually for the identity, because currently we have a solution here in the kingdom, as I mentioned a while ago, called IAM, which is for the national personal identity, and it's already been applied on Tawakkalna, and we use it. I think all the ministries are using this. If you would like to access to any ministries to do anything, for example, whether it's an industrial or whatever, you will automatically use IAM, so your identity will be identified while you're accessing their portal. And similarly, we are using the same thing. And furthermore, you know, in Tawakkalna, as I mentioned, during COVID and during the past maybe 2-3 years, you can access all the family members. For example, my kids, I can see their marks in their schools in each semester, which is it's a national. It's connected to Ministry of Education. Similarly, I can access to request to go somewhere, to subscribe for Hajj, to order things. So it utilizes this and accessing many services in one. Similarly, in Ministry of Health, we believe in the new model of care that we need, very important, to patient-centric. We need to activate a patient, to give him an information, to let him access to a personalized education, to serve him, to make sort of an orders, empower him to do some of his. In addition to that, to really work on the lifestyle to improve his daily activities and so on. So also accessing all the medical records of my family, at least those who are below 13 years, and whoever gives me access to his file beyond that. So initially we started, you know, when you are starting the digital transformation, you don't have much of accessing to all regions, all facilities, all clusters, because you don't have a system of record across all these areas. So what we did is that we try to build the primary healthcare across the kingdom, so that the people, most of you are utilizing this, and having an apps that serve certain particular services, because we believe that we can start from system of engagement with the patient. So the patient, he can access utilizing an app to get some consultations, to have an artificial intelligence, you know, triaging, as well as to have a direct consultation with the physician. Also to do booking, to go to any polyclinic. So these sort of things, we started with it. And now all these services, whether the teleconsultation or, are merged together to build a super app. And within that super app, you can have additional things like have digital twinning and these things. So that's I so started as that, and we're gonna reach to have something similar to Tawakkalna, but at the level only of healthcare services that give all types of information, as well as access to all types of services. And I agree with you 100%. The identity is a key in that, and we are utilizing, as I mentioned, the national infrastructure to do that. By time they are currently accessing all the national or the central solutions. By time they're going to be accessing the unified health record, whether the financial or the clinical data that's on my own file. Of course we're going to use biometrics also in the app, so that it will help also to prevent others to access it.
That's really helpful, Ahmed. I guess I want to ask Christina though, while we're talking about data privacy. We're talking about identity. We're talking about the use of data here. How do privacy laws fit with medical records in Saudi, Christina? Can you give us an insight into that?
Well, it's a bit of a gray area at the moment. There were some recent overarching, applicable across sectors, across the kingdom, regulations in terms of data privacy that were issued. They've been pulled back and are still under further consultation and development. So it's certainly a watch this space, right? The kingdom is well aware that privacy and data security these are huge issues, and they're working on developing them. They're seeking to implement the new regulation during the course of next year. But it does leave some questions, especially when it gets to healthcare and those who are going to implement technology solutions from abroad and implement them into the kingdom. What we've seen in other parts of the region, and this is what we are hoping, and I'm pushing for and working with the government to try to do in due course, is to take the national level regulation, so that there is no GDPR style regulation in Saudi, but what we will have is a national level data privacy law, hopefully next year, and then work with pushing down some of those authorities. So yes, it will cover healthcare, but what we've seen in other parts of the region is then it allows the health authorities to create certain use cases, use exemptions, where actually the interest of the patients is indeed served by transferring that data overseas. Of course, it's not a pure exemption. Now you have to do no compliance. You can just send the data and do what you like. No, it would be rather, you can send the data under these certain standards, under these certain security requirements. Something else the government is looking at is even maybe the possibility of things we've seen in the EU and with the US, although that didn't work out, but hopefully we learned from that, which is data sharing sort of permissible agreements at the country level. And so it's an evolving space. There's no answer for you yet, but it is a space that is being worked on. And there is a recognition that while our law is pretty much data localization centric, there is recognition that some data can be useful to send overseas, especially when you get into highly technologically or highly advanced healthcare services that just aren't applicable or aren't available on the ground and need to use data centers that are offshore for that analysis. So a little bit of a watch this space.
I'm thinking then, Christina, that basically for those organisations that we have in the room that are looking to work in Saudi, it's very much a question of something that they need to think about is that there will be legislation and regulation in this space coming down the track.
Yes, and as of right now, it's not that it's unregulated. It's more on the especially when you're dealing with government facilities. Yeah, these are more restrictive. We're in government information from government healthcare facilities. The current answer is data localization. You'll need to work with a local data center, and so this would be a key topic to discuss with any of your governmental contracts.
It's a really helpful insight. Glad that we've touched on it. Ahmed, sorry, you wanted to come in?
Yeah, just we have in 2015 9 policies was meant to be for the interoperability standards. It was 9 policies specifically for the interoperability standards, and also last year 2021 the National Health Information Center also issued a data governance, I think, document. It is quite good document considering these areas. And actually they did that from something called the National Data Office, which is at the national level. And they have offices across every ministry to work precisely on that. In addition to the security as mentioned by our colleague Christine. And I believe as what mentioned at the national level next year, we're gonna have something published, very well mature that can run the whole things.
Really helpful. Linking to that, then, we have a question from Simon Swift at Methods Analytics. Simon.
Thank you. I've enjoyed the discussion around data and putting together health information systems, and the use of standards particularly is music to my ears, and a single form of identity management. I'm the founder and managing director of a company called Methods Analytics, and we're a specialist company focusing on helping people use all of this data to make better decisions. So we do data collection, integration, governance, platforms, all of that, but other people do that as well. The bit that we really focus on is the analytics, the data science, and the AI to use this data to make a difference. So that's the question I want to pose to Mr. Etham and Mr. Ahmed. What is your sense of the maturity of the use of data to understand and improve the quality, outcomes, and efficiency of services and the quality of outcomes and experience that users of services receive?
Etham, do you want to come in on that one first?
I think Dr. Ahmed first, and then I will continue from there because he's better than me.
Thank you, Asif. I agree with you. Agree with you, Simon. Actually, improving the input and the processes will improve automatically, the output. And furthermore, you know, the more utilization of accurate data also will improve the outcome, will improve the efficiency, will improve the quality. And this is what we are looking in healthcare, to improve the quality, safety, productivity, as well as access to care. And also data, we consider it as the most important factor to improve all healthcare service, whether at the level of the persons, as well as at the level of community and the population health. And I believe we are in a good position. Why I say that? As you love, you know, the area that we have, the standards are there and approved. I mean, regarding data standards. Also, how we're going to exchange this data also is something that's also well defined. And all these things of standardization is already published and approved. Also, utilization, of these standards, whether in the central solutions, national level solutions, or in the edge solutions, or whatever solutions will be, consumed by the private sector or clusters, specifically if they are looking into doing something specifically. Because, you know, we believe that the clusters are totally independent, going to be independent, and they are accountable, and they are thinking from a business-driven organization, and they are doing the same thing. And soon we can see the Ministry of Health, for example, started to have a command center, which helped us to manage the time of COVID, as well as monitoring, you know, what's a program called ADA, which is having a KPIs that we are monitoring in that command center and in the teams to improve the healthcare service. And the clusters, soon they're going to have their own command center to monitor these KPIs and to improve their situation. Of course, they're going to have different problems. They will innovate in the way they are thinking to solve it.
Thanks, Ahmed. Aslam, do you want to add to that?
Yes, actually, from the point that Dr. Ahmed started or ended, I can start from here. As a cluster, when we started gathering this data to only get the requirement for ADA or for other authorities, we are facing too many problems. The maturity of the systems or the maturity of the level of information that we have, it was not that good at that time, because they used to be, as a hospitals, silos. So the standard for the HIS, the standard for the information there, and some of the systems or the hospitals, they don't have an HIS. So getting this data from these hospitals, talking about our cluster, it is 22 hospitals and 130 healthcare centers. So getting this information, it was a great challenge actually. And we actually got a unit for that thing, to do that thing. It's business intelligence unit. Actually, it's data unit, which will gather this information and structure the data actually, because even until now, we don't have full structured data for all these hospitals. So we are building these capabilities and also have a project now for the data warehouse for the cluster to meet the requirement for the government and for other sectors. So for sure, it is a great challenge for us, and hopefully, inshallah, soon we will just overcome these challenges. And the good thing again, actually, we will start from what everyone ended. So we will not reinvent the wheel. We will just get this, let's say, experience from the companies, our partners, and continue from there forward to get the requirement for ADA and also the requirement for our cluster. If our cluster, if we want to go for ACO, we should also overcome our problems by getting our own KPIs, getting our own measurable elements, so we can go further for the future.
Thanks, Hassan. All right, we're very, very short of time, and we've still got another 5 questions we need to get through. So I'm going to move on to Abi Shaki. Abi, do you want to give a very, very quick introduction to yourself and your question, please?
Thanks, Steve. Afternoon, everyone. My name is Abhishek, and I lead the digital healthcare team here at Mott MacDonald. We help clients, healthcare clients, design and build hospitals which are future ready and which embed digital at the core of it. So this extends right from the design and the build of the hospitals and how do we use digital as part of that, but also from an operational perspective in terms of everything to do with healthcare information systems, but also patient and staff engagement and experience platforms. We're currently sort of working on one of the largest health infrastructure projects here in the UK, and we're having a similar conversation with a number of clients across the globe. in terms of reflecting back on the last couple of years, we all in the healthcare world, and as in everything in our personal lives, we quickly transitioned to a virtual world. And now we're sort of returning back to a sense of normalcy. We still, I think we've settled into a bit of a hybrid ways of working. And that's fair to say that's similar for healthcare. So in terms of care is still being delivered, some of the care is still being delivered virtually, but we still see the importance of so in-person interactions and coming into healthcare facilities and hospitals and so on. I suppose my question to the panel is in terms of as we settle down into this hybrid healthcare delivery model, how do we ensure that we're integrating the physical and the digital worlds so that we're still delivering the care is end-to-end and integrated, and we're not compromising on patient and staff experience for our stakeholders.
Thanks, Abby. Mansoor, you're heavily involved in the infrastructure sector. Can you give us any insight into this in terms of how digital and virtual and physical infrastructure are being developed together?
Yeah, I think there was a lot of, everything was negative about COVID, but there was one positive was that there was a mindset also of the patients and the doctors also that, unless you see a patient physically or a patient see a doctor physically, they cannot be, treated and all those sort of things. But it was COVID forced people to move towards, digital health and other things. So in our opinion, it cannot be de-linked. You cannot 100% digital health or 100% now physical health. Now, as I give you the number, like around 150,000 outpatient in a year in Saudi, which will be around 150 million, which will be increased to 220 million by 2030. Now, most of these patients, and looking at the disease profile, especially when 40% of our lifestyle diseases and a number of them, the old patient and other. So there could be a balance which will be beneficial for the patient and for the doctors and overall for the Saudi government and the investors, that you don't need to build double the number of clinics and other, and because you will still have face-to-face interaction, or if there is a need, or if there is a change in your health, you will go to the hospital or physical place. But we see that there will to achieve 2030 goals of Saudi, it cannot be achieved unless there is a blended mix of physical and digital health together. And the country, the investor and the patient have realized that, and they are going into that direction. And that will be, that will save the resources, which will be, otherwise you'll be building 50% more clinics, and there's 100,000 more beds, 27,000 more beds will be required. That can be reduced and put more into, and also you need to look at, one last point is, Saudi is quite big. The distance is quite big compared to if you look at some smaller. So it is not possible, even in Riyadh, this is not possible for a patient to visit very regularly to a doctor. Depending upon the traffic, it may take, or depending upon the location, it may take 2-3 hours to just go and see a doctor for 15 minutes. So that will be having, a combination of both will be the best solution for Saudi.
Thanks, Mansoor. Sam, from the Eastern Cluster's point of view, of course, you do cover a very large area, and you've got some real rural areas within the Eastern Cluster. How are you going about trying to blend the virtual and physical provision of care?
Actually, we are doing, thank you for this question. Actually, we are doing this one currently with the help of MOH. We are running the virtual clinics, and we are having the KPIs for this thing. We are blending both options. Actually, it's already now embedded with the healthcare centers system. So when you are calling, for example, calling a patient, you will send them an SMS for the virtual clinic, and he can be with you in the virtual clinic for the regular things, let's say for the follow-ups, for the things. And even we are utilizing it for some of the home healthcare services. So instead of visiting the patient, we are just only giving him a call, virtual call, and checking with him the whole thing. Or let's say the team will be there with him, and one of the team members, let's say the doctors or one of the healthcare centers, they will communicate with the patients remotely. We are covering really a huge area. We are just talking about the kingdom from the north to the south, the eastern side of the kingdom. So we can see with the normal ways, we cannot do it. And thanks, actually, one of the benefits of the pandemic, it was giving us or accelerating this option. So currently now we are talking that already this virtual clinics already embedded with the systems, and we are utilizing this one, and even we are good in the KPIs for the Ministry of Health that we are doing it in the right thing, in the right way. And now we are embedding it also for the hospitals.
Thanks, Hassan. That's really, really helpful. Let's move on to our next questioner, Phil Ashworth from Patient Source. Phil, you've got a question for us.
Hello. Yes, I think my question segues quite nicely into this. We've talked about how the last few years, the advent of digital following coronavirus has helped accessibility. Just a quick introduction to myself. I'm Phil Ashworth, the co-founder and chief operating officer of Patient Source. We do an electronic patient record. We have looked and dabbled a little bit in the region, but my question is really around, has the last 2 years changed the approach to doing business in the region? I think the root of my question here is really that businesses shouldn't be under any illusion that to implement a record system like this, you need to get on the ground in the region, right? But the journey to that point is really where my question is. Has that changed? And in association with that, I think if you think about the spectrum of companies and the size of those companies, you have a small number of very large companies that have no problem in putting boots on the ground to find prospect business across the globe. And at the other end, you've got small companies where for them to do that, they're essentially betting all on black to do business overseas in a particular region. So I'm just wondering, in Saudi Arabia, has the journey to winning business changed slightly, and can that be done more remotely, and therefore opening up the opportunities for innovators from overseas to bring those innovations to the region?
Well, Christina, I think probably you're the first place to go on this one. Do you want to give us a bit of an insight into how easy it is to set up and do business in Saudi, and how much can be done virtually or upfront before having to actually kind of put boots on the ground?
Well, you're exactly right, Phil, what you've mentioned. Just across the region, and Saudi's no exception, there is an emphasis on face-to-face. Of course, I think, and this is not an official response, this is purely my just during my 8 years of observation here, is that many companies are happy to make a profit and happy to come to a country where they can make a quick profit. What the countries here struggle with is people who are truly invested in the country, people who truly care, people who aren't looking to make a quick buck and then get out and go somewhere else. And that's why there is an emphasis on spending that money and making that investment. Of course, that flip side is, yes, smaller companies might not be able to do that. But you can imagine how many contacts the government officials get to say, use my technology, use this, use that. And the downfall is that they're just looking for a quick contract and that's it. And so I think the government's quite the officials are quite well aware of that. So there is emphasis put on those who are willing to make the time, physical presence, effort. Also, you see from a foreign investment perspective, while Saudi has greatly opened up, and we must be quite clear about where Saudi has come in the last even 5 years. Yes, tourism not too long ago was not permitted, and here we have a country who's opening to tourism and foreigners, and so the laws are changing, and very rapidly changing, again looking at where the country has come just in the last handful of years. And so when you look at even putting your boots on the ground and setting up a local entity, still from a MISA foreign investment perspective, it's not simply that where 100% foreign ownership is permitted, you simply can set up. There are still capital investment requirements. There are still 3 years often is the case, 3 years of accounts needed to prove that you are a company that essentially can be relied on and won't come here fold and have no backing to support. So I think there is still an emphasis on tried and trusted businesses being those who are coming here. I think the country's not quite ready to let foreign pure, newly startup companies, because if you look at just the numbers, even in the US, the number of startups, even in the mental health space, thousands and thousands and thousands and thousands. I think I looked at it, 22,000, something like that. These aren't all going to last and they're going to fold. And what happens? What happens to the patients that are relying on that care? And so while on one hand you say, look, small businesses can't enter and access, I think given the growth and how quickly things are changing, the flip side is a little bit of a protectionism, wanting to work with people who have a solid backbone and a solid, again, all unofficial, just my observations of this. But like I've said, the doors have opened. The foreign ownership pathways are much more open than they were. Like I said, the opening to 100% foreign ownership. We've seen the numbers come out of the Ministry of Commerce as to how many foreigners now have those foreign investment license, rapidly growing. Hope that addresses it in some way.
Yeah, no, that's helpful.
That's really, really helpful, Christina. And actually, I'm going to be the second answer for this question. I think I'm going to do it myself. Because the other thing, Phil, I think that's really important when looking as a small company to enter a market like Saudi Arabia is don't do it on your own. And actually, that's probably the reason why I want to kind of make this point myself, because Healthcare World, that's kind of one of the things that we do as an organisation is try to bring together companies like yourselves as Healthcare World partners to enter the market together. We're doing a lot of work out there at the moment. Christina and Al-Tamimi, organisations like them are really, really helpful in terms of giving us the insight that we need. But the other thing, and the other part of your question, how do small companies, how do SMEs get involved in Saudi Arabia? I know from the work that I've done with the Eastern Cluster that those guys are really, really keen on seeing innovation, on seeing companies coming into the market. And actually, from that point of view, the really good news is that there's a fantastic opportunity coming up, particularly in the Eastern Cluster. And I know you'll kind of back me up on this one. The Eastern Cluster are putting together an event in December, which we're hoping to be heavily involved in at Healthcare World. I think it's the 6th to the 8th of December. They'll be doing a conference in Al-Khobar in the Eastern region, at which they're looking to invite suppliers, both digital and otherwise, from across the globe to come and understand how the cluster works, what the opportunities look like, and how they can get involved. And that, I think, is going to be a perfect opportunity for SMEs and other companies to get involved in working in the Saudi market. So hopefully that's helpful. Let's move on to our next question now. And Jyoti Mayham from Healthcare First.
Thanks, Steve. I can join if you want. So I'm Jyoti Meehan.
You remember.
There you go. I'm Jyoti Meehan. I'm the Chief Exec of Healthcare First. So we are a large-scale primary care operator based in the UK and also positioned as an international advisor on primary care establishment. Again, as everybody else has said, I've thoroughly enjoyed the conversation today, and we've sort of focused a lot on data and infrastructure and how we do business. I kind of wanted to pivot the question a little bit into sector and solution. So question for me really is, primary care is obviously an emerging area in the kingdom, and as is digital. So I'd love to understand a little bit more about how you're bringing the two together, so both digital and primary care, and what you actually see as some of the opportunities going forward that are above and beyond sort of infrastructure and data sharing.
So, Dr. Ahmed, I think this is a good one for you. How is digital being used to deliver primary care in the kingdom?
Okay. Thank you very much. Now, it's not that easy when you are starting, for example, in a vision that have 20 clusters are going to be having different solutions, and you would like at the same time to have a unified primary health care solution across the kingdom. But actually, in the initial times, we thought that we believe it's unlike before. I mean, that we need to start with systems of engagement where we can communicate with the patient directly. and empower, the clients how to build information, personalized education, as well as to activate the patient to access to services, and also to interact with his care plan, and also to include some socio-economic health determinant factors about that patient, and that will be a game changer, actually changing his lifestyle, focusing on the mental health, chronic disease, and also to improve the chronic disease outcome for that patient, and also to introduce and to utilize AI. So the idea was how to have a unified primary healthcare solution across the kingdom, which will be bounded to that system of engagement with that particular patient. And because having it fragmented from day one, it will have a difficult to have a national level building, for example, population health at the national level, as well as having a super app that can manage everything. As time is going now, since we are very, approaching having the unified health record, now, even if we have a digital solution for primary health care, separate or different across each cluster, it will still support having the unified super app that's accessing the patient unified health record. This is at this phase. So that was the thoughts initially, how to start engaging the patient connected to sort of system of record across the kingdom and provide the service very quickly, which is almost done. And now by time, since we have already having the unified health record approaching, now even if the clusters would like to have their primary health care bounded tightly to their EMR in the hospitals, they still gonna be able to have the same access management. And this is the biggest challenge, is how to have the model of care where we are case coordinating the patient service across his journey, and at the same time utilizing multiple EMR solutions in the primary health care as well as in the hospitals.
Thanks, Ahmed. Assam, do you want to add anything to that from a regional point of view? We heard there from Ahmed how that's working on a national level. How specifically are you approaching the problem in the Eastern Cluster?
Yeah, actually, by using one unified electronic medical record and HIS, we are now managed just to implement the, let's say, clinical pathways for these healthcare centers with the help of MOH. So all the program or transformation program requirements, now we are reflecting it using the digital solution that we are having in this healthcare centers. And also now we are working with the company called Lean, who is having this system or working with this system to connect it also to the HIS. So the journey for the patient from the primary healthcare to the tertiary services, it's already connected in both ways, bi-directional, just from primary to tertiary, and again from tertiary to primary. So this one, and also along with the other preventive or proactive activities that we are doing with our population. And even we're using this platform to do the program for population health now. We are now inventing, or let's say we are working now with our partners forward to have a model for the population health that is suitable for our need.
Really helpful, Assam. Thanks very much. Let's move on to our next question then. Hayley Levine from Radar Health, do you have a question for us?
Yes, hi, I'm Hayley. I'm the head of marketing at Radar Healthcare. So we essentially help healthcare organisations to manage risk, incidents, and improve patient safety. Essentially, we're here to help make healthcare safer. My question's a quick one. So my question is, so how do you see the role of, and sorry if I say this wrong, of ADA within the health cluster model? And how do you see that in the future as well?
So Dr. Ahmed, I think you talked about ADA earlier on in the conversation, didn't you? Do you want to pick up on that one?
Okay, maybe I'm not the best one who can speak about that, but it is generally it's a KPI, organizational KPI that's feeding a strategic health goals. And actually it started from the beginning of the transformation, even before having any supportive digital solution. So it's really emerged from its business leads actually. So, and at the same time, our colleagues implementing ADA, KPIs, increasing the number of teams, doing the pilot initially and increasing more and more. And it was mainly onto three main things to improve how to utilize really the data and the digital solutions well, and how to improve the processes, I mean, within the facilities, from the efficiency, from the quality, from in addition to that, also to build up the environment really that and the culture that have a continuous thinking of changing and improving. This is they try to implement these ideas and thinking within our clusters. And they started with initial pilot KPIs, and by time they are reaching now thousands of colleagues involved, hundreds of leaders, and they have almost 100 also of KPIs. I don't know, maybe they exceed 200 or so. In addition to that, we are monitoring, the overall satisfaction from the patient side using the Press Gain, sort of. And we are seeing every quarter how things are improving, although we are not yet implementing maybe vigorous solutions, except this ADA, continuous improvement and monitoring. It helps us really a lot. It changed, the mindset of our workers. They know what's the targets that they need to improve, where are the areas that they need to do, and they think really, and they innovate in thinking and finding out how to improve. It's unify really the goal where they want to reach. We are continuously learning and improving, and we achieve, a tangible, measurable improvement and changes. And we discover where are our weaknesses and how to fix it. And as I mentioned also, I believe it is really a smart move, and it's really it starts quickly. It's built the environment actually to improve. And by time we are seeing, and I believe as data more collected through our EMR solutions, our daily more digital solutions, as more data points we have, and as more better feasibility and understanding, and being really fine-tuned and best discovering where are the problems and how to fix it for each clusters. And I feel maybe my colleagues from Western Province Eastern Province will tell us really how they benefit from that better than me. He is on the ground, I mean, in the field.
Estem, yeah, do you want to add to that?
Yes, actually, thank you, Dr. Ahmed. From this perspective, we started from doing it manually, and now we are discussing it with the National Health, let's say, Data Management Office. So how can we get it digitally or electronically from these digital solutions directly to them, instead of collecting it manually? Because when we started this journey, some of them are collected in Excel sheets. So the data from these hospitals or healthcare center manually collected. Now we are moving for most of these digital, let's say, hospitals to get the data from our office, let's say, business intelligence office, to generate these reports to ADA directly, and instead of doing it manually. And actually, it helps us a lot. These KPIs and these standards, usually we are having it in, let's say, the daily huddle meeting with the hospitals. So how can we fix things? How can we make it there? And we are having some now follow-up mechanism to check this ADA KPIs where we are sitting now. Let's say if we are in the red zone or green zone or this one, to help us to improve our services day by day. Because these ADA KPIs, it's really reflecting what we are having in the ground, especially for risk scaling. Okay, thank you.
Thanks, Estem. That's a great answer and very, very helpful. Let's move on then. Elliot Angus from Infinity Health. Do you want to put your question to the panel?
Thank you, Steve, and thanks to the panel for their time. It's been really interesting and already answered most of the questions I would have had. I'm CEO and co-founder of a company called Infinity Health. We're a task management solution. So we allow healthcare staff to plan and coordinate care, assign tasks to one another, send notifications. We can also automate high volume and mission critical processes. So we drive an enormous amount of efficiency, safety, and improving the quality of care that's delivered and the consistency of care. In the UK, we're very constrained by legacy systems, lack of interoperability standards, but also sort of existing processes and behaviors. And that's a real challenge to scaling in the UK. So we're really excited by the greenfield system that you're developing. It's a very exciting opportunity. I suppose what I'm most interested in is timing. So we see it as being essential that health information system that you described exists first. So that data layer of electronic health records and patient administration is foundational. on which lots of things are built, including Infinity. So, and then for Infinity to scale, we would integrate with that. So I was just wondering, to what extent, it sounds like the Eastern region has made incredible progress on that. I was just wondering to what extent that data layer has been rolled out and what the timeline to that would be, because that would be pivotal to Infinity being able to add value at the right time.
Dr. Ahmed, do you want to take that one?
Yeah, I believe it varies across different clusters. So, but the foundational components of what Infinity can maybe work on top. For example, if it's doing like notifications, so you need to collect some of the patient problem list, and you would like to just send them notification, education, or reminders or so on. So this maybe if it's part of it. So some of the national level maybe components of the data, it might be there. If you go into more, granular details or more, different encounters, occasions that require hospital visits or so on, it might require clusters maybe, or that have more mature implementation that's integrated like the Eastern province, as mentioned by our colleagues. And also if it's require access, for example, to generate an intelligent, emerging notifications. So access, for example, to the lab packs, summaries and problem lists at the same time. So it might require to have the unified health record in place, so that in this case you would be, because it's going to collect around 15 use cases, including the lab results, medication orders, medication dispensation, and orders, all of its kind, the referrals, discharge summaries, encounter summaries, antenatal delivery summaries, as well as immunization. So it will gather many large. So it depends, the inputs that you are looking for to generate whatever messages or things that you would like to send. If you have certain use cases, you can match it, review it based on the readiness of the clusters and on the data, and you can pick which use cases you can start with for the solution that you have. So I believe, for example, visiting our colleagues in the Eastern province and matching, the use cases that you have with the readiness of the data elements you are looking for, and see from there the percentage of value that you can give them among the package that you have. This is my suggestion.
Thank you.
So Aslam, it sounds very much like you guys are ahead of the game in the Eastern cluster in terms of kind of getting this stuff ready. How have you managed to get to the stage you have, and what advice would you give to the other clusters now that are starting up and trying to catch up in that regard?
Actually, thank you for this question, and also thanks for Elliot. And from Elliot's point, I'm saying that if we can start with it now, even now, because we are now moving forward to get to the, let's say, optimal solution. We can do the analysis from now, the assessment from now, and get the requirement. So if we are moving forward, we need to plan it. And we need to get the data and designs and everything ready from now. Especially we are moving forward to cover other, let's say, areas and other hospitals with this one. So from your point, to start with, we should start now even. And we should start even before. But we can start now, and we can continue together in this thing. And you can say to have something like POCs of this one for these products, so we can continue. And also it will be a great chance for people that we are trying this product or checking these products and roll it out to the other clusters, and to work as let's say a model of joint ventures with us, so we can also roll it out to the other clusters and to the kingdom nationwide. And we will welcome you as a great partner with us also.
That's a very nice introduction. Thank you.
I think that's one of the great point that you make, Hassan, because I think one of the great things about where you're at in the Eastern cluster, and it's probably just worth explaining this to our audience, isn't it? You are the first cluster, so you are in many ways the vanguard, the guinea pigs. So how has that been for you, to be the first ones on the ground trying to do this ahead of the others? Has that been challenging?
Actually, it's really a great challenge. It's not only challenging because you need to be a role model for everyone. And from our point of view as a digital health, we are saying that we need to set the standard or the role model for other clusters. If they want to move to digital era, they should do it in this way. So we really did the extra mile by doing extra things. From, let's say, from alhamdulillah, we have great team and great capabilities, let's say from manpower capabilities, and also the great help of MOH and other, let's say, key players. And actually, we have key players with us. We have Sadaya, it's Saudi Data and AI Authority. We have also in IC, we have cyber security with us. We are working together forward just to get the, let's say, the optimal or let's say the perfect combination for the cluster, how you will be as a cluster now and for the to be in the future as a SEO company.
As a flagrant plug for Healthcare World, I actually did an interview last week with Dr. Ahmed Masayed at the Eastern Cluster, which I would thoroughly recommend our audience to. I'll be posting it on LinkedIn and online as soon as I can. And what amazed me was actually just how much progress you guys have made in the time that you've been working on it. It really is quite astonishing. Moving on, I mean, I just wanted to ask Mansour, because we haven't heard from Mansour for a while now. The beginning of Elliot's question there was really interesting, wasn't it? Which is the problem in the UK has been that point about building on the back of legacy systems, what's there already and how you then adapt it. Mansour, as somebody who's been involved in the Saudi market for a long time now, is this a problem? Are there legacy issues? Are there problems to overcome in terms of what was there before? Or is this truly starting from a new beginning?
We've been working in Saudi market for over 23 years. And what we have seen is there is a great shift in last few years or so. There is no, attachment to the legacy and other. They are looking to revamp the old project. There are a number of projects which will going to revamp, but it is not that you have to attach to any legacy. So in a nutshell, the market, the mindset is, to do the best, not linked to what is being done before, or we need to carry forward what was done before. What is best for the country, what is best for the sector, and what is best in the end for the patient. That's what I've seen it, and we always feel proud to be working in Saudi market because of this thing.
To follow up on that, one comment, because I've been talking a lot about Saudi. I think I went out to Arab Health in January, and sort of took some temperatures, had lots of conversations about what opportunities there were in the Middle East region, and very much came away with the impression that Saudi is the place that we need to be in the next 5 or 10 years. It's the most exciting opportunity in the region. When I say that to people, there are a number of people that I talk to around the world who sort of go, "Wow, we've been talking to the Saudis for however many years, and it's a lot of talk, and things aren't happening." But it feels to me like that's really changed, Mansour. What has changed? Why is it that it's now becoming so much more dynamic and opportunities are really starting to come to the fore?
I think one thing which Christina has mentioned was that change in laws. The laws has changed, which allow a lot of regional and international player to come. On the other hand, we work and invest Saudi, and this which did a lot of good marketing for Saudi all over the world. And people have seen it that, and then the way Saudi, and we just published a report a week back on Saudi hospitality education sector, the way the hospitality or the travel and tourism has moved from purely, which was majority religious tourism, to opening up Al-Mu'ula and others. So the heritage sites and the Red Sea and other. So there is an overall shift, which has basically, so market was always there, and it was growing very fast. So there's a lot of catch up need to be done. But what has happened is that in last few years or so, the way, I put it very bluntly, the way Saudi was marketed, it become very much a place where everybody wants to come and do the business. Before that, people were saying, "Oh, Saudi, I don't want to go there," maybe. But now they say, no, we would like to go there and do the business. So, the other thing is the open-minded, open mind, the way they are doing all the reforms and other. They look at different countries, different models. When we present some good ideas and other, like we did a lot of work on long-term care, rehab and home care, and then IVFs and other. People are willing to listen that how it was done successfully in other regions and the countries, and how it can be adopted quickly here. And I think the last thing I would like to say is that from both government side and the private sector, obviously, the projects are, quality is not being compromised, but they are commercially driven. They don't want to waste money.
Couldn't agree more, actually. I think that's one thing that I would say in the time that I've spent a lot of time over the last few months in conversations with the Eastern Cluster and across Saudi, and that openness to ideas, the openness to wanting to have the conversation and understand what they can teach and also what they can learn from other healthcare providers and healthcare systems around the world is really obvious. Christina, you wanted to come in on this point.
Yeah, just to echo what you've mentioned, we look at what has happened in the country in the last handful of years, and we're only 5 years into Vision 2030, right? This was issued around 2016. So much of the first part of it was much about strategy, organization, things like this. Now we have the new private sector participation law. You'll see the Ministry of Health PPPs that have been put out more recently. I think we are starting to shift more into the privatization of the market, encouraging that side of it. You're seeing now the Eastern Cluster, the first ACO or the first cluster now starting to shift from strategy into trying to stand on its own as an accountable care organization. These are just happening. And so I can see how people maybe were ahead of the game 5 or more years ago, where those opportunities, the ideas were here, the conversations were here, but the contracts weren't quite ready here. They weren't quite ready to fully bring in the private sector help. Of course, lots of strategy work, lots of putting together the ideas and processes, but now I feel we are much more into the implementation phase. And like we've all addressed here, the openness of the market, the ease of doing business, ease of travel to Saudi, all these things I think will make the next 5-10 years look much, much different than the past even 5 years.
Yeah, and it's interesting. I think over the last weekend, we saw the proclamation from the Minister of Health, the formal formation of the Health Holding Company, which, for those who don't know, is the organisation that sits above the clusters and drives the delivery side of Saudi healthcare, and also the formation of the National Insurance Company, which ultimately will end up being the funder of healthcare in the region. Ahmed, Essam, I wonder whether either of you'd like to comment on that. How significant is that announcement, is that proclamation that was made over the weekend? Ahmed, do you want to comment on that one?
I didn't get you kindly. If you could repeat what you'd like.
So at the weekend, last weekend, we saw the formal recognition and the formal formation of the Health Holding Company, and the separation to have the Ministry of Health as regulator, the Health Holding Company responsible for delivery and the clusters, and the formation of the National Insurance Company. Is that a significant moment? Is that a significant milestone in the Vision 2030 program?
It's 100%, 100%. This is the dream that we think of over the last, maybe I can tell you, 6 years, since 2016, when the transformation strategy started. Ministry of Health, that was a dream, the final goal, when this step to be reached. And all the work over the past, years, having some clusters doing sort of a pilot, evaluating how they're going to be separated really as an ACO, how, whether from financial, human resource, it was a great also effort have been done by everybody, across in the ministry, in how to market this, how the people, they will perceive it as a population, and how our teams, our colleagues, physicians and so on, they accept it. It's really a moment that everybody excited and waiting for. And I believe also after announcement is it sounds good for everybody. And I believe that all what alhamdulillah, I was part contributing in that effort initially. The things that we draw and design, it's now will become a reality, and the benefit will be inshallah will be seen as it's really become the first ACO has become totally really separated, and as the company take over the operation from Ministry of Health totally.
And I think that's a great contribution to finish on. It's been a fantastic session this morning. I've learned a massive amount. I remain hugely excited about the opportunity in Saudi. We will be having more Healthcare World sessions on the Saudi program over the next few months, with sessions on capital projects and infrastructure and the delivery of clinical services coming up in the next couple of months. So please do sign up for those. And of course, we'll have more news very soon, we hope, about our partnership with the Eastern Cluster and the delivery of what I think will be a fantastic conference in Cobar. It only remains for me to thank all of our questioners. Thank you for some brilliant questions and some brilliant thoughts from you guys. But of course, most importantly, our panel, Mansour from Colliers, Christina from Al Tamimi, and of course, the brilliant SM Al Newman from the Eastern Cluster. Thank you so much for your contribution. And Ahmed Belkar, Dr. Ahmed, thank you so much. So many really helpful contributions and a lot of information. Thank you also to our audience for watching. I'm so sorry we couldn't get to audience questions. I did have a few through. I'll see if I can maybe pose those to the panel offline and email answers to you if they'd be willing to do that. But that's it for today. Thank you so much for watching. If you want to watch again, the recording will be on our website in the next few hours, and I'm hoping to post it on LinkedIn as well. Thank you again. Have a great day. See you soon.